Welcome to Thoughtfully Us, the space where three therapists of color sit down to talk about mental health, real life, and the human side of healing. We're colleagues, friends, and licensed therapists. And so in this podcast, we're pulling back the curtain on not just therapy, but on being people of color in this field and on the parts of life we don't always get to process in the therapy room. So whether you're in therapy, thinking about it, or just trying to make sense of your own healing journey, we're so glad you're here. A quick disclaimer is that this podcast is for informational purposes only. It is not a substitute for therapy, medical advice, or diagnosis. Listening to this podcast does not create a therapeutic relationship with any of the hosts. Tease up for Thoughtfully Us. Hello, listeners.
Hello, everyone.
Hi, everyone.
It is Maya, Morgan, and Nelly. And this week, we wanted to do a episode kind of highlighting different mental health aspects within the Black community, specifically for Black History Month.
The whole month of February, Black History Month. So I might as well talk about some things happening within the community as well. So we'll dive right in. So if everyone knows me, I like having statistics of things to explain my points sometimes. So research background. Okay. So according to the Office of Minority Health, which is under the Department of Health and Human Services, but these stats are from 2024. So I believe they're true. So in 2024, Black and African American adults were 11% less likely than U.S. adults overall to report, having a mental illness in the past year. So underreporting is a big part of this community, as well as some other communities of color. Also, 36% of Black and African American adults were less likely overall to receive mental health treatment in the past year. So not only is underreporting a big issue, but seeking out and receiving treatment for your mental health issues is another big factor. And so just thinking about those two, what are your thoughts, comments? People who are listening are wonderful listeners. What are your thoughts? What are your, perceptions and perspectives on why there's such a big gap in the data?
Well, it feels like there's definitely I don't know, from the therapist side of things, that makes a lot of sense to me. I'm like, one, there's not there's definitely a huge part of the therapist community that is not people of color. So lacking of that lived experience, I think makes a huge difference. We really struggle with that. I have clients all the time who want to work with a Black therapist and then are like, I can't find one, so you're the next best. And I'm like, no, this is not okay. Let me try and look for one, right? Because that is what someone deserves to have that.
Yeah.
But also in therapy, and I don't have a citation for this, so do your own research as well, listeners. But I remember learning about how, for example, Black boys are often misdiagnosed with things like ODD, oppositional defiance disorder, when experiencing the same symptoms as, let's say, a white boy who would be diagnosed with something like depression. So,
yeah,
I think stereotypes, prejudice, discrimination all shows up in diagnosing and then shows up in treatment. And then kids and adults aren't getting the right services and treatment because of misdiagnoses. I think the same thing with ADHD.
Yeah, me too.
Yeah,
A lot of kids, are misdiagnosed with ADHD and when really they're doing completely normal, developmentally appropriate behaviors.
Definitely. I like that you bring that up because I do think a lot of clients, communities of color, but also specifically Black individuals do try to find, therapists that look like them. And I know we've talked about we need more, right? of Black men, we need more Black couples, we need like all of these different things as well too, just to I think help kind of process not only what's going on in their experience, but to try to erase some of the stigma as
Mm,
well and be like, oh, okay, this can be, a safe space for me too.
yeah.
I think it goes back to like a lot of mistrust. I think, Morgan, you asked like why you think that. I would say mistrust of the system. So that includes medical primarily, but also mental health within that too, for some of the reasons both of you said. But I could see why it's kind of hard to even report if no one's kind of coming forward or seeking the help.
hmm And I
Definitely.
will say, quick tangent, because Nelly and I were in a training together. Was that last month or December? I can't remember, but it was a good training, and the um, facilitator did well. It was about perinatal mental health and postpartum work. But there was one instance where she mentioned just the accomplishments and what's the word? Like prestige of John Hopkins
Mhm.
University Medical Center, John Hopkins Hospital, very well known across the country and I'm sure around the world, and is located here in Maryland and Baltimore. And yes, it is a great hospital. We're not trying to dig at it at all, but it is a medical setting with a very vast history of discrimination, prejudice, and some like racist, um,
Mhm.
like research and procedures and things like that. Thinking about Henry,
Unethical.
yeah, unethical. That's a good word. Thinking of Henrietta Lacks, which if you haven't heard of her, definitely look her up, uh, and all of that. So yes, the facilitator mentioned John Hopkins as a great resource, which yeah, but me and Nelly were like, that's actually kind of maybe, I don't know if triggering's the word, but not like she had to read the room a little more because there were a
Yeah.
few clinicians of color in there who know, like, we understand the history behind John Hopkins that many other people of color and Black communities also understand. And a lot of
Mhm.
the mistrust we see today is because of settings and communities like John Hopkins that were just untruthful, unethical, and discriminatory. So that's something that caught my mind when Maya mentioned stigma as well.
Definitely. Because I think a lot of times it's like we're looking at some statistics of like, why are these things going untreated? Why aren't people seeking help? Without understanding like the structural medical racism that Black communities have been facing for a long, long time. So we're recommending something like Hopkins, you know, to especially like in the perinatal world, like a new mom who's already maybe distrusting of people and worried about how they may be judging her as a mom, like probably wouldn't feel super safe going there.
Mm-hmm.
So I think again that's why it's so important to have like lived experiences in who you're working with because and it's not necessary, but I think it can be really important because I think all the like people of color were like I don't know about how like I'm not sure about that.
Mm-hmm.
Uh, I think also in that same training there was we talk about like mortality rates um with like zero trigger warning and like zero kind of pause for what that was going to be like for the Black clinicians in the training. Um, and things like that are just, that wears on your mental health constantly, hearing about these things. And I think I remember texting you, Morgan, because you were pregnant, and I was like, this is probably not like a very, supportive conversation right now for you, and I'm sorry that like that is not addressed first. So I think that's an example of just like the many, um, I don't want to say micro because they're not micro, but like the constant exposure to racism, and how that really wears on your health and well-being.
Yeah. it's something that the facilitator could have done, like Nelly mentioned, is preface it or say, like, we're gonna talk about this, I want to hold space, or like acknowledge these things. And going back to like other medical settings like Hopkins, I'm sure they've acknowledged the harm they've done and are working towards being better every day. So that's, a step too. Uh, so
Yeah,
that's always a positive thing.
fair. What do you feel like, if anything? Because I know, it's February's been going on for a little bit. I feel like day one of Black History Month, I see a lot of, I know we talked previously about social media, so a lot of like therapy spaces online kind of give out information, resources, that kind of thing. Was there anything you feel like you saw, you were like, this is great, like bringing awareness to, or anything you feel like is missing in the conversation so far?
It's a good question.
I feel like what's missing is support for Black providers. Um, like it's a lot. Like I recognize that when I am saying before, like when I use the example of a client who's looking for a Black provider, and then I'm like, hold on, like I think that's a lot of pressure to feel like you're kind of this revolving door of I'm really needed and I have to kind of, and I think a lot of therapists like burn themselves out in that way. They're like, I have
Oh,
to
yeah.
work outside of my hours or like see this
Yeah.
person because like when you traditionally maybe you wouldn't have taken on a new client, but then a client is like, I cannot find this type of provider I'm looking for. And then you're like, okay, like I'm gonna figure it out, right? But
Mm,
that like wears and tears on you all. And so I think like I haven't seen a lot of discussion on support for Black providers.
yeah, that's a good point. That's a good point. I would agree with that. And then I guess also like ways to continue the conversation. So it's just not for the month of February.
Yeah.
Yeah.
What do you think, Maya?
I feel like I see a lot of, or at least this year, because I really can't remember what I saw last year, but this year a lot of like historical facts of like some of the things. Henrietta Lacks wasn't in what I've seen so far, but just other people who made like pioneers in the health space or science space or mental health space I've seen, which I think is great too, to bring that, awareness. And some of those things, I didn't know or I've learned, as I've gotten older too. So I do think that's important. I'd probably just say, kind of similar to what we talked about in our New York series, is just like highlighting some of the lack of safe spaces for minorities again, but specifically for the Black community too. So looking at things like what's going on in our current world and how we might be feeling and navigating spaces, and a lot of trauma and discrimination type things. So I feel like I see a lot of that of like, you belong in every space and those type of things.
Yeah. Which I like. I like
Does
that.
it ever feel like performative for you guys?
Guess it can. Guess it depends on who and like, is it a company that only comes out in February?
Yeah.
Things like that.
Yeah, I don't know. I see a lot of the word resilient is a lot. But I would say that's for women in particular, but
Hmm.
I see that a lot, and I see a lot, that's probably what I've seen the most, is trying to not use that word as much. I see a lot of Black history related things like, okay, women, like you don't have to be strong, you don't have to be resilient. Like there's other ways to kind of highlight empowerment and strength without using that, because I think that word, like we throw that word around a lot. We learned it a lot, in school, name someone who's resilient, and it's like, oh, okay, so I want to be described that way, but then you're like, actually, do I?
Mm-mm. No.
Because it's tiring, and also just creates like a whole different narrative on like things you had to go through as well. But I would say that can feel performative if certain agencies, companies, or people are using that word a lot and not really recognizing like the systems that make it so challenging.
That makes a lot of sense. Almost like forced string. Like,
Yeah.
I don't want to be strong all the time and like
Mm-hmm.
maybe instead of celebrating strength, we can look into how to actually release and be
Mm-hmm.
able to not have be put in situations where strength is necessary.
Yeah.
That
Exactly.
makes sense.
But
But yeah.
both those things, I think, lead to kind of the shortage we see. It circles all the way back to the beginning of the episode. Kind of like a shortage of providers, mental health as well, but we're
Mhm.
therapists. So definitely in the mental health field of Black therapists, counselors, psychiatrists, psychologists, you name it. But then burnout, which Nelly mentioned as well. And so, one more stats for you. In 2022, which was a few years ago, so I'm interested to see if the number's still the same, but 2022 survey found that 45% of women and 37% of men who identified as Black or African American therapists were experiencing or considered leaving the field because
Mhm.
of burnout. That's a high number for both men and
Very.
women.
It was like, what's going on? Well, I do think context is interesting. So it is good you said like 2022. I would
Mm-hmm.
be interested to see what the number is now. I know 2020, like I can imagine where they're pulling some of their data from of like the pandemic and
Mm-hmm.
a lot of the Black Lives Matter movement, um, too, which would make sense. That's where my mind went. But I would be interested to see now if that number is, I imagine higher,
Yeah, I was
maybe.
gonna
I
say.
don't know. Yeah, I don't know. Like, what if it is higher or lower? I don't know. That is interesting.
I feel like it probably is higher.
Why do you say that?
Um, I think
You're like,
our
why is the sky blue?
yeah, our like current administration policies that have changed, like a decrease in shame. Like I think a lot of people, I've heard a lot of rhetoric with like white people who are like, this president has taken us this many steps back, and like people of color are like, yes and no. Like this racism has always been here. Like it wasn't gone. Obama did not like come into office and it was like poof, racism. Like,
Mm-hmm.
um, but it has like taken away the like our decreased shame in it, and like there's this like proudness with it, and I think that proudness, I would say higher because that proudness shows up in our sessions too. Like I know all of us have had experience with working with racist clients and like having to hear people talk about that and like sit in that. Like nobody taught us that in grad school. What do you do when your
Mhm.
client is saying things that put you at harm, and you're having to like follow your same therapy guidelines? So I'm like that would make a lot of sense for why people would leave the field,
Mm-hmm.
because the field's not set up to protect in that way.
Yeah, just a lot of, which is hard because I think what you mentioned earlier, Nelly, is like the pressure to kind of keep showing up, right? Because you're like, okay, the field needs us. We leave grad school not to like bring back our New York series, but we just opened so much where we like leave school and we're like, we're ready, to do this work and go into the field. And then I feel like a year in, I was like, I'm ready to get out. Here I am still in it, but like there's been highs and lows, burnout, that has come around. And I think navigating that and different things, like you said, like what is there to support not just the clients, but the clinicians, the social workers, that, whatever kind of uh, job title you have. And I think that is why I could see the number being double too
2025,
in
2026.
2020. Yeah, yeah,
I
for
also
sure.
was going to mention, I guess this relates to outside of the profession, but like the cost of living doesn't help. And
Mm-hmm.
then we've talked about therapists really don't make a ton because of the systems with insurance, how much they take away from us, and how hard it
Yeah.
is to kind of make a
Just how
decent.
valued things might be too. Like,
Hmm.
you know, the insurance might cover, but only like 3 sessions. Sometimes I
Yeah.
hear like something crazy where you're like, okay, but this isn't like helpful
Yeah.
actually.
But I think that, like, fighting with insurance companies,
Uh,
cover clients, but also pay us well, is big. Um,
Yeah, it's doing like really hard work and then not being fairly compensated for it. Like eventually that gets exhausting.
yeah, yeah, something like
yeah.
that doesn't help. And then all the just the stuff you have to pay for, continuing education credits, your license renewal, supervision. It all adds up. So
Like
it's
Never
that, why
ends.
is that stuff so expensive if we're not getting paid? Like if we're not making that? I don't get it. And like there are ways you can hustle and make more money in
oh yeah.
the therapy world, and yet like we all do that already. Like there's not, you know what I mean? Like it's like not realistic of what's actually feasible. And oftentimes people who are able to kind of like invest more and take risks have more money to do that with.
Hmm.
Or it's like a few years in too,
Hmm.
or they finally can figure out how to do that too.
Yeah.
Hmm. Yeah, it's something
But yeah,
else.
it's a lot, I would say,
Yeah.
too. But it just depends. But I do like this month. I feel like a lot of clients I have, I would say a lot of my clients kind of identify within the Black African American space. And they have been, when Black History Month started, different things, we might talk about it like, oh yeah, my office does this. Or I've heard a lot of like my office or wherever I worked used to do something and they don't anymore. Like, I
Um,
just feel like there's so much around there that again kind of stems from current times, policies, all of that. So there is a lot even within that of like, how does it look for you,
Yeah.
again, to be Black in these spaces is, I feel like what this Black History Month is showing.
but also
Yeah.
joy. See a lot of
Hmm.
things about Black
Yeah.
joy, and like, despite everything going on, we love our culture, we love our skin, we're proud of our strength, even though, again, that could backfire. But I've seen a lot about joy and fighting against everything by remembering what we're proud of and who we are and things like that. So that's been really nice to see.
Yeah,
I think
I
that's
would say so.
important to see. Like we don't see that enough in our media and like also in our entertainment, like in our
Hmm.
movies and TV shows and things like that. Like we aren't seeing that accurately depicted. And so
Hmm.
again, like that wears on you. So I think that Morgan, like I wonder if that's a way, because I think a lot about like Black History Month and what like I'm personally doing and how much of it is like actually useful, right?
Hmm.
Like how much are we doing because we think it's useful and how much are we actually hearing from Black voices about like what is useful? Um, and
Yeah,
so I think that's a good piece of information that you've shared with us of like
yeah.
celebrating and acknowledging and highlighting Black joy is important.
I think the joy is great actually, because there's some people I know of other races that use this time to like, I was trying to think of who puts out the list, but I know there's a list, there's probably many, because I had someone who said, "Oh, I like to go through this list that's like sent out. I don't know what news platform of like movies to watch during Black History Month." But I was thinking, I was like, I wonder if they're all rooted in more of like civil rights movements, slavery type. I don't know, like if there is movies depicted of just Black joy, Black love, because there really aren't that many, but I think that would be good for them to add those to the list so they're not always just seeing like Black suffering and resilience. I'll use the word, but rather just like more like fun and upbeat things, like you said, of just excitement and culture and that kind of stuff.
All right. Well, my last stat, and my we're over this, but Black representation in the mental health field.
Mm.
So there's about 4 to 5% of psychologists who identify as Black, very small. 2% of psychiatrists, which is so little.
Wow.
7% of marriage and family therapists. 11% are professional counselors, and 22% are clinical social workers.
Hey yo.
You have the highest social work. But yeah, you can see how small these percentages are, these numbers.
Yeah, the 2% is
The
shocking,
2%.
actually.
Also, it's so convenient that the two highest paying mental health like
Mm,
professions, psychologists and psychiatrists, are also the ones that have the least.
the lowest, right?
Huh?
Yeah, that's a good point. But those, even like psychiatry alone, I'm like, I get it. All the med school and stuff you have to
Mm-hmm.
go through. But for those listening who are like, I want a career in mental health, maybe consider psychology or psychiatry. We need you.
But I think there's a reason, right? Like, I think access, you have to you have to have a certain level of privilege to
Oh, yeah.
go into those things, right? And so, like, I don't know. I'm all for like the discussions on diversifying our field, and also it feels useless to talk about it without talking about why Black and brown communities are not engaging in these
Yeah.
fields. And like, I don't know if that, like, if school was free and we had access to things, like, I don't know, maybe we would have been, like, the three of us would have done something else. Like, I probably would have explored psychology, but I ultimately didn't because I also like wanted to work with vulnerable and underprivileged populations.
Hmm.
But it's just crazy that like everything that goes into it. So,
Yeah. And
Yeah.
psychology is such a big major and a big like experience, I think, for college students.
yeah.
But I feel like everyone takes a Psych 101 or some kind of psychology class, and then I guess it fades out. But yeah, so I'm like, there's a gap. Something's happening.
Yeah.
Yeah. Which I think is hard too, because, when clients do seek Black or uh individuals of color for therapy, I know sometimes they want their whole treatment team to be that way, and it's hard. I remember us growing up, Morgan, we always try to seek out Black women primary care physicians, but there just really aren't that many too, and just different things like that. But if clients maybe wanted like a psychiatrist or someone else kind of still within their community and just being like, there just really isn't anyone right to like refer to or in this area, that can also be hard because then you're kind of like, will they even follow up if it's not because there's already, mistrust and that kind of stuff. So that stat is interesting. 2% will stay with me.
2%. 2% is great. Like,
I
that
know.
is
Let
wild
me see
and
what year
really,
this was.
yeah, you'll
This
have to look.
was from the Association of Black Psychologists Incorporated, and the survey was from, whoops, oh, there's so many videos. Okay, from 2021. So I don't think it's changed that much, but
Yeah. Ugh.
I'd be interested to see as well. So yeah,
Well, it's really upsetting.
now.
I feel like that's really upsetting. But again, I feel like we recognize needs, but don't look at how you could get there. And it's like,
Mhm.
we know that we have these needs, and so things should probably be incentivized for Black
Yeah.
communities to be able to have access to these, knowing that like there's a reason that we're hurting on that. But here we are.
Oh. Well, I will say I've seen two universities. One's in DC. One I one might be across the country, but they're offering like free tuition for residents of that city because they know that there's a big shortage and a big gap
Wow.
who identify as, I think, Black, maybe other populations of color. I don't remember the school. I'll have to find that. And so, I guess to end, I'll wrap up with this quote I saw during my 3 a.m. social media scroll because I have insomnia due to pregnancy. If anyone else has experienced pregnancy insomnia, let me know. But this says, I see no color is not the goal. I see your color and I honor you. I value your input. I will be educated about your lived experiences. I will work against the racism that harms you. I will check my prejudice and do better. You are worth fighting for. That's the goal. And I was like, wow.
Love that.
I like that a lot. I saw that not at 3 a.m., but I have
Yeah,
seen
like,
that
not at
online.
3.
Yeah, but I do like that a lot.
Yeah.
I love
So
that.
that's the goal of today, too. We're talking about Black History Month, but also just different issues in the Black community that also extend out to other communities of color. But people always ask, how can they be an ally or advocate or do the work? And it starts by recognizing the lived experiences. Like, there's just so many differences in the way we all see the world based on our culture and background and family history and things like that. So I always think, people say they don't see color, which, yeah, I guess that's nice, but it also does more damage in the long run. So the goal is to see color.
Yep.
Thank you.
Because you can see it, and it's there.
I was gonna say, kind of like would scare me if someone said they couldn't see it, because what do you mean? But
Yeah.
to
Like
each
from
their
dress.
own.
Remember the famous dress that was white or
Yes, the like
gold or
gold.
I saw white and gold.
I always saw blue.
Interesting.
I always saw white and gold too.
But I just want to thank you both for sharing, your experiences on today's episode and for sharing and doing this work every day. Because I know it's not easy, and there's a lot of pressure around clients, needing and appreciating people like you in the field. But I know that's not the easiest thing when this field is not really set up for us to succeed. So
Hmm.
thank you both for doing the work that you do, and then for also sharing about this other side of you all on this podcast.
Oh, thank you. Proud to be part of
Thank
the
you.
22%.
That's crazy,
Yes. Same. Thank
But we
you.
did it. All
And
right.
send us whatever you find on Black History Month to our listeners. If there's anything cool or interesting, or again, things more centered in Black joy, we would love to see them and acknowledge them.
Yes,
man. Send it our way.
Send it to us. All right. Until next time, thanks for joining. Tease up with Thoughtfully Us. Bye.
Thanks so much for joining us for today's conversation. We hope you felt seen, supported, and maybe even laughed a little along the way. If you enjoyed today's episode, please subscribe to the podcast so you never miss a new one. And we'd love it if you left us a rating or review. It really helps more people find us. You can also connect with us on Instagram at thoughtfully_us and let us know what you want to hear about next. And remember, while we're therapists, this podcast is not a substitute for therapy. If you're struggling, please reach out for support from a mental health professional in your area. Thanks for listening, and we'll see you next time.